Welcome back to the Physio Table. Today we're answering the question, can a ruptured ACL heal? In short, the answer is yes. Evidence of ACLs healing after being torn was shown back in the 1990s. We've also had results from the recent Canon trial that showed that up to 30% of ACLs showed signs of healing within a couple of years. We also recently have bracing protocols for torn ACLs that are showing healing rates of above 70%. So yes, a torn ACL does have the potential to heal. Do torn ACLs heal well? ACL healing basically can go from a pure anatomic healing where it looks like it has never been injured. It is a great healing process and it looks perfectly normal on scan. This can be graded down to looking not so good to having an ACL that is stretched and sagged and maybe one that just has a few threads hanging on. So the degree of healing is in fact quite variable. Not everyone will get a well-healed ACL, but certainly the potential for the ACL to heal exists. Do you need to have surgery for your torn ACL? Again, this is a complex question. For some people, having surgery will make sense. It is something that is fairly well known in the outcome. It's probably got the shortest return to activity time frame. And for people with a time pressure, for people who have to go back to manual work or physical work, then having surgery will probably keep them away from work for the shortest period of time. So there are many reasons why there may be a good indicator for having surgery. There are, of course, risks to having surgery. Not everyone who has surgery makes it back to their level of sport or activity that they previously were at. It can be as low as only about 67% of people don't make it back. There are complications with surgery. You can get fibrosis, you can still end up with an unstable knee, an unsatisfactory outcome, and the rehab process may not go as well as you want. Combined with this, the cost of surgery can be expensive for many people, and they just may not be able to afford to go to surgery very quickly. Other people may find that a bracing protocol is suitable for them. This will often depend on the type of ACL injury that you have and how soon after injury you're able to start commencing a bracing protocol. This may be suitable for people who don't want to have surgery, for people who can't afford to have surgery and want to start something immediately. And there are some reasons why this can be a good route to go through. Of course, that's the best outcome is that you have a normal ACL and you have avoided surgery. You can, of course, choose to have surgery later. There are options to not even try a bracing protocol and just go for rehabilitation and see if that will give you a stable knee. And the current recommendation is for a lot of people, if you can, try 3 months of rehabilitation and see if your knee is stable. If it's not, then that is a good indicator to go for surgery. So basically your choices are this. You can go for immediate surgery. You can try for non-surgical rehabilitation, have a trial and see if that gives a good outcome. If it doesn't, then proceed to surgery. You can try one of the bracing protocols that is available, and these involve being in a brace for a period of weeks. Or you can try none of the above, and you can just decide I'm either going to do nothing and because I'm not going to return to that activity anymore, or you can try I'm just going to do some strengthening and rehabilitation, no specific bracing protocol, and just see how my knee turns out. In America, there's an interesting new option available, which is called the BEAR protocol. This seeks to put in a linking bridge between the two ends of the ACL to hold them together to try and get some natural healing of the ACL. And this is certainly something that we're looking at with interest as it shows some promising results. The final option that is also turning up now is a non-surgical procedure, which is called a PRP injection, platelet-rich plasma injection, or a bone marrow aspirate concentration. These have only been recently trialled in ACL ruptures to see if they can promote healing of the ACL and get a well-healed ACL and a functional, stable knee once again. So options are emerging, and the idea that a torn ACL means you must have surgery now is shown to be not necessarily so. Considering your options with your surgeon and physios and discussing your circumstances, what your goals are, what your timeframes are, and your specific situation is the best way to come up with what is the best management plan for your torn ACL. If you have any inquiries, please follow the link or fill out the inquiry form below. If you are having difficulty with ACL rehab and would like some help on developing a rehab program, we can arrange a consultation, a telehealth video consultation, and that can be done for you as well.